Today I'm going to tell you an interesting story about a urinary bladder stone. This patient is a 36-year-old gentleman that has painful urination. He has problems when he's peeing. He has pain, and then he has abdominal pain, belly pain. This is an X-ray of him. The belly button is around this level. He's facing us. The chest will be up there. This is the bladder part. This is the left hip, the right hip. This is the back, the bone, and then the black air. They are the air in the bowel. So basically, this is abdomen X-ray, and then everything is normal except there is something that's even denser, even more dense than bone. Looks like a rock in the lower pelvis. In the middle of the rock, there's some kind of a lucency. Basically, it looks like something less dense than the rock in the middle of it. Looks very not usual. So we obtained a CAT scan. The CAT scan was done without intravenous contrast, even though we want to do it with contrast, intravenous contrast, but the patient cannot tolerate it because the kidney is in failure. The contrast in the vein could damage the kidney even more because the kidney is already very weak, so we didn't give it. And now we can find out why the patient's kidney is not working well for this young patient, because this structure is causing obstruction of the ureter. This is a kidney. The kidney's normal pelvis, that's the urine, that's the kidney making the urine. Normal pelvis is maybe that size. This is a hugely dilated renal pelvis. Basically, that is the big urine ball that doesn't like to go down. Even the collecting tube, that's called ureter, that basically transport the kidney from urine from the kidney to the bladder, is very dilated. Normal size is maybe this size. By the way, this is not a ureter. I'm just saying that's the size, but this is a wide dilated tube. Same thing on the left side, not as bad as the right side, dilated. So basically, the urine doesn't go out of the kidney, and therefore the kidney is backed up, just like traffic jam. It doesn't like to work because you cannot get rid of the waste urine. That's why the kidney is in failure. And we can find out the kidney. Let's go into detail why this kidney is not working. This structure, it turned out, is denser than the bone. It's a rock, basically a stone. This is a front view, but I told the plane to make sure to image exactly a perpendicular, just cutting that line of a foreign body, which is a line that would cut it like a sausage directly on. So this line, you can see the stone is forming around it, one layer, another layer, another layer, another layer. So seems like this line is causing the stone to form around it. This is the eyeliner pencil. Same thing here, you can see it. The pencil is in the middle. On one side is kind of protruding out a little bit, so the stone is forming around the tip of the pencil on this side, and keep going through the stone. The other side, why the stone doesn't really follow the liner, because the pencil is going outside the bladder, tip all the way here. So the bladder, the eyeliner is half in and half out. So this is the other view. This is a pencil from here to here. The bladder form. I think the stone is from the calcification that usually in the urine, plus chronic inflammation and possible infection of the bladder that result in the stone forming, sticking onto this eyeliner pencil. Is the bladder wall stopped right here, so the urine doesn't go beyond that part, so the stone stopped here. The pencil keep going beyond it for another maybe 3 to 4 centimeter. The body is trying to form scar tissue around it, because by that time there's no urine can contact the pencil. The body is trying to form a scar tissue around it, just like the splinter inside your body, not on the skin. Because of location of the stone is right on top of the opening to go for the urethra, so it's difficult for this patient to pee, because whenever you are trying to he's trying to squeeze, the bladder contract, squeeze down, this stone function like a stopper, so it's harder to get the urine out. Therefore the bladder has some diverticulums. Let me see, where are they? There's one here. There we go. That's a bladder have a diverticulum, a little head. Basically, it's a outpouching of bladder, because when the bladder was trying to squeeze so hard, part of the bladder wall was weak enough that some part of the urine going down, some part of the urine go kind of like a little balloon that have a little part of the balloon is weakened, thinner. So when you squeeze the balloon, most of the air go out of the hole, but part of the balloon which are weak can make a little extra bulge. We call it diverticulum. And this is another side effect of this. The bladder is chronically inflamed and have something stopping it from emptying. If the bladder doesn't empty, and then it backed up to the kidney. So this is a story of this patient that somehow get the eyeliner through his penis into the urinary bladder, then result in stone, and then resulting urinary obstruction, and resulting in renal failure. If that young patient present with a renal failure and without kidney disease, and you would wonder, how did a young patient get the kidney failure? He needed to get a transplant for the kidney. So now it's one story about this patient. Anyway, this is an eyeliner pencil. This is a stone, regular bladder stone. They are from infection. Look like that, like that. It's not like our stone. There are many causes. Bladder stone can cause can be from the urinary catheter. For example, you have a catheter in there all the time. It's function as if it is a pencil. Basically, that can form if the urinary bladders have a catheter in there all the time. So could have stone. Or people who are paralyzed and unable to pass urine, they need the catheter to drain the bladder. So that's a kind. The bladder doesn't like this kind of catheter for two reasons. One is can form stone. Second is can cause infection. The infection also irritate the bladder, can result in stone. So when the stone are there long enough, then could cause bladder cancer. It can cause obstruction of the kidneys. So that is the Wikipedia story about the bladder stone. And then the backup of the urine is called obstructive uropathy. So basically, somehow we have to remove the stone and put a stent in there, so make sure the drain from upstairs from the kidney to the bladder without any difficulty. The prognosis, if it's short-term irritation, the kidney can recover, but this kind of a long-term irritation, the kidney may not recover. So this is the story. Thank you.